Hello, and thank you so much for joining us for this video series titled Teaching and Learning Evidence-Based Relationships, Interviews with the Experts. This project is brought to you by the Society for the Advancement of Psychotherapy, Division 29, and is a companion project to the third edition of Psychotherapy Relationships That Work. The overall goal of the project is to translate relationship research to teaching and learning from the classroom context to clinical supervision. My name is Dr. Raina Markin, and today we are very fortunate to be joined by Dr. Paul Peluso, Professor and Chair of the Department of Counselor Education at Florida Atlantic University. He is a licensed mental health counselor and a licensed marriage and family therapist. The topic of today's discussion is how to translate research on facilitating emotional expression in counseling and psychotherapy to teaching and training. Thank you for joining us, Paul.
Thank you for having me.
Absolutely. So I guess to start off, if you could just start by explaining how you define and operationalize emotional expression in your research.
Sure. Well, it's actually easy to do and also difficult to do as well, because there's a number of different channels by which emotion is expressed. It can be verbal, it could be in terms of facial displays, and it could be in the form of nonverbal displays as well. So we chose a very broad approach when we looked at the literature, looking for any articles that had affect or emotional expression, emotion processing, in order to get the largest pool that we could. And then we winnowed it down from there. Specifically, we were looking for variables that captured actual expression of emotion in session or a recollection immediately after the session, because we thought that that would be the clearest indication of an expression of emotion in session.
Mm-hmm. And is it a challenge to differentiate emotional expression from experiencing or processing of emotion? How do you sort of take that into account?
Yeah, I think that the umbrella of emotional expression kind of covers, experiences of emotion. Obviously, there are some experiences of emotion that both clients and therapists may have in session that might not be easy to distinguish either on the face or in the voice or with body posturing, although a lot of it really does get captured fairly well. So I think what has been done up until now has been fairly encompassing. Of course, there could be other methods of capturing that if you wanted to get biomarkers, heart rate, respiration, galvanic skin response, and other things. But I think for what we were looking for, we got a good representation.
Great. So could you summarize some of the main findings that you and your collaborator found in this recent meta-analysis with emotional expression?
Sure. So my collaborator, Dr. Robert Freund, and I looked at, we originally were tasked with doing two meta-analyses for this chapter, one on therapist expression of emotion and its impact on therapeutic outcome, and then expression of client emotion and its effect on therapeutic outcome. In the process of going through our data, we found a lot of studies that also had embedded in them expression of emotion and its impact on or relationship to the therapeutic alliance or therapeutic relationship. So we actually expanded ours and did 4 separate meta-analyses that were included in the chapter. One on therapist expression of emotion and the therapeutic alliance, one on client expression of emotion and therapeutic alliance. And although those weren't really the central focus of the chapter and of the research that we were tasked to do, the other 2 was therapist and client expression of emotion on therapeutic outcome. And those were the really more important, more meaningful ones. I'll try to summarize them really quickly and not inundate folks with statistics and the like. The first one was the therapist expression of emotion on the therapeutic relationship, and that actually had the smallest number of studies. We only found 6 studies, which was barely in the margin of being an acceptable meta-analysis. And there we found a medium effect size, a small to medium effect size of about 0.27. And this was an R, or correlational effect size. And that translates to a D, if folks are more familiar with the Cohen's D statistics, of about a 0.54. And then one of the other things that we did was we calculated what's called a fail-safe N, because of what many researchers think is a bias in journals, where they only publish, or they tend to publish, articles that that only have statistical significance in them. The idea is that in the file drawers of professors all over the world, there are studies buried in there where the findings were not statistically significant and therefore couldn't be published. So there's a statistical method for correcting that by finding how many articles would have needed to be published with an effect size of 0 that would reduce the effect size that we found down to 0.1, which is the low level of significance. And for this particular or meta-analysis, 10 articles would have had to have been published to counteract the effect size that we saw here. And that's actually an important number to pay attention to. We're looking at kind of what's the magnitude or the impact of the effect, at least from my perspective. Others might disagree. Let me move on really quickly to the next one on the therapeutic relationship, and that's the client expression of emotion and its effect on the therapeutic relationship. Now, there we had 20 studies, and we found a slightly larger effect size. It was a medium effect size, but slightly larger. It was 0.30. That translates to a Cohen's d of about 0.63. And the fail-safe N that we had to calculate was actually 45 studies. So 45 studies would have had to have been published with an effect size of 0 to bring that effect size of the 0.3 down to a 0.1. So again, more than the one before. But now we get into the two meta-analyses that I think were the most important for the study that we did. The first one is therapist expression of emotion and its relationship to therapeutic outcome. Client therapeutic outcome, I should say, not therapeutic outcome. And there we found 13 studies in all that met our criteria. And the medium effect size was found of a 0.28, translating to a Cohen's d of 0.56. And the fail-safe N to counteract that would have been 23 studies published with an effect size of 0. The final one, the fourth and final one, and this was sort of the big one, actually had the most number of studies. It had 42 studies that met our criteria, and this was client expression of affect and its impact on therapeutic outcome. And there we found a medium to large effect size of a 0.40, which translates into a Cohen's d of 0.85. And again, the file drawer problem calculation that we did showed that you need to have 138 studies of an effect size of 0 in order to bring that overall effect size down to a 0.10. Now, this is where things also get a little bit interesting because we found that there was a moderator here as well. There was an issue with homogeneity. And so we looked at different moderating variables, and one of them popped out as being significant. And that was the type of rating that was used in the study. So the difference between self-rating of emotional expression and external observer rating of emotional expression. So interestingly enough, 36 out of the 42 articles had an outside observer rating. And when we looked at those, the meta-analysis effect size jumped up to 0.45, from 0.40 to 0.45, which is equivalent to a Cohen's d of 1.01. And then when we just looked at the last 6 that were self-rating, the effect size dropped down from a 0.40 to a 0.20. Although statistically significant and considered a small effect size, you can see the difference there. And so we thought that was really kind of an interesting finding in the analysis.
Yeah, yeah. And some people I think might wonder if theoretical orientation was you were able to look at that as a moderator in the study?
Sadly, no. There just weren't enough of the articles that we found that had a specific theoretical orientation or pitting one against the other. There just was not enough for an investigation of that.
Yeah, yes. Future directions.
Absolutely. Yes.
I mean, I think your meta-analysis, your research, and just clinical experience, right, suggests just how central emotional expression is. It's sort of I think in many ways, it's not only important to outcome, but to all these other process variables along the way to outcome, including probably things like the alliance and maybe even other relational elements like empathy and, all the other chapters in the book coming out, So I guess given sort of your clinical experience in this and your research and your recent meta-analytic findings, how do you suggest as educators, as supervisors approaching, teaching students how to be competent in facilitating not only affect in the clients, but also in themselves in, therapeutic ways?
All those are great questions. So let me try to take them in two separate directions. Let me start with the teaching part of it. I think two elements that we need to possibly investigate or go back to is training clinicians in a theoretical grounding on what is emotion, where does it come from, and what is its meaning and significance. I think that with the advances in clinical neuroscience or neuroscience in general, I think that we can have a more robust discussion and methods of teaching students about the place of emotion in terms of its relationship to cognitions, its relationship to neuro and anatomical structures, and the like. So I think that's one area that we need to introduce more mindfully, I would say, in our training. I think the second thing that we could do much better is train clinicians how to recognize displays of emotion in clients, displays of emotion on the face, going back to things like universal displays of emotion. And there I'm thinking of the work of Dr. Paul Ekman, his work with micro expressions, those things that happen very quickly. I'll give you an anecdote from my early days as a clinician. I can remember working with clients, and I would see something change on their face. A wave would come over their face or something, and I would stop. I would try to use some immediacy and say, oh, I saw that your face changed there. Kind of what was going through your mind at that moment. Subsequently, I've been trained a bit more in facial displays of emotion, and now I can actually decode that for the client, because sometimes they don't even know. I can say, you flashed a little bit of contempt there, or you flashed some disgust. I'm wondering, what were you thinking, or what were you feeling in that moment? And a lot of times, clients are surprised that they actually betrayed that or showed that on their face. And then sometimes it also facilitates a sense of, you really get me, you really understand me. Yeah, you saw that, which can be very helpful for clients who maybe in their families of origin or just in their lives tend to be more emotion dismissing, or they weren't able to give those emotions a label or a voice. So I think that could also be helpful as well. And training students on how to recognize those emotions in the moment, I think can be very facilitative.
Yeah. So sort of, I think bringing in some of basic science research and neuroscience research on emotion to give students sort of that understanding and the framework and the grounding.
Absolutely. And there's some really amazing findings that are coming out about neuroanatomical structures, the insular region of the brain, the anterior cingulate cortex, other areas, the orbital prefrontal cortex, that we're just scratching the surface on, but I think will have significant impact on the field in the years to come.
And what advice do you have, I think in terms of helping students facilitate their own affect as therapists? Because I thought that was another interesting component of your meta-analysis as well.
Yeah, and the research there is actually pretty strong. I was trained in an era where emotional displays, emotional expression was not very widely taught or privileged, and I think that oftentimes is detrimental to the therapeutic relationship. In fact, some of the research that we reviewed actually did show that therapists who tended to suppress emotion, that tended to have a negative effect on the therapeutic relationship. So I think on the one hand, you don't want therapists to over-emote, and maybe bring in some countertransferential instances. But on the other hand, to suppress emotion and kind of come off coldly to the client, I think also can create a negative feedback loop in the therapeutic relationship, and can make clients feel somewhat, I don't know, scrutinized or under the microscope, and it doesn't promote that warm relationship that we know is so important in therapy.
Yeah, and I think just in my experience as an educator and a supervisor, I think developmentally helping students realize that cutting themselves off from how they feel about the client is cutting themselves off from a whole wealth of important information about the client and about how the client relates. And it's kind of cutting yourself off from all this important therapeutic information.
Absolutely. I think the wealth of clinical writing that's been done kind of more on the non-psychoanalytic views of countertransference and how to use those countertransferential feelings to help connect with the client, I think are incredibly facilitative. I know a lot of the work in family therapy literature looks at that and talks about that. And I think that's very helpful to train students on how to deal with their own internal experiences, and then determine if they are appropriate or not for the therapeutic interaction.
So when you train students in this, in facilitating emotions, I mean, what are some of the common challenges you encounter, and how do you go about sort of trying to remedy those challenges?
I think for students, the biggest challenge is getting them to admit when they're feeling more negative feelings in a session or in the moment. I think they fear that somehow that negative emotions and negative affect are inherently wrong. And one of the things that we've done in my lab in looking at coding video recordings of sessions, is that we find that oftentimes there are moments in the session where some negative affect or some affect that you would code more negatively actually is important to helping keep the client on track. So sometimes you have to interrupt the client, sometimes you have to sort of kind of force them back onto a topic that they don't want to be on. And so that can come across a little forceful. And a little directive, and that can have a negative emotional valence. But sometimes that's exactly what needs to happen.
Yeah. So, I mean, do you kind of talk about that research with your students, or sort of what's your approach in kind of changing the mind frame around negative affect?
Yeah, we introduce a lot of my lab's research into the teaching of our students here. The other thing that we do a lot is watch a lot of video, watch a lot of either the EPA's products psychotherapy sessions, the six sessions in that particular approach. Also, Alexander Street Press has a great product where they have a lot of the older family or older therapy with the expert series on there, and what I counsel our students to do is to look for those videos that have actual clients in them, as opposed to the ones that use actors. And there's nothing wrong with the actor-driven videos. It's just that the expressions of emotion aren't going to be as genuine or real. And I get my students pretty quickly to be able to determine which ones are accurate and which ones are kind of manufactured. So I found that the ones that, the late John Carlson put together, he always used live clients in the demonstrations with those master clinicians. And I find that students can pick up on that. And they also get to see that, sometimes therapists don't always do it perfectly. And I think that's one of the great blessings of those kinds of videos, is that the ones that are live and in the moment, sometimes you're going to have those therapeutic ruptures. And of course, the work of Jeremy Safran and his colleagues in repairing alliance ruptures is just so informative. And then you get to see those examples and how some of these masters can actually effectively repair, and then how some of them don't, and then what happens after that. So it's really pretty fascinating.
Yeah, no, it's really fascinating. And I think that's another important area of future work for training and research is that I can't imagine a rupture. It's hard for me to imagine a rupture being fully repaired without some emotional expression,
Absolutely.
usually on the part of the patient and the therapist to some degree.
Exactly, and it requires, as you were mentioning earlier, it requires that that insight and that awareness to one's own feelings and possible expressions as well, and then helping the client to be able to also decode the emotion that they're seeing and feeling in the session, and not feel like they're entirely responsible for it, and having the therapist take some responsibility for that as well. I think that's key to repairing a therapeutic rupture.
Yeah. I think a challenge that I find as an educator, often with beginning therapists or counselors, is that um, kind of there's tends to be a pull towards wanting to go to like the action plan or even the thoughts or the skills.
Mhm.
And even sort of when I go through the whole basis of affect and the research behind it, and I'm like quite proud of myself, for doing the whole, landscape of the research,
Mhm.
there still tends to be this really powerful pull for,
Mhm.
novices to want to go to, you know, thoughts and behaviors, which, also are important and have their place, but it's hard to keep them there at the affect. And, I was wondering if you ever find that and how you kind of go about managing that, I guess, or approaching it.
Yeah, so one of the things that I've found, and it's kind of paradoxical, is that beginning clinicians in their desire for targeting cognitions and behaviors and like, also tend to want more techniques. They
Yes.
want to know
Yeah.
what I'm supposed to do here. What's the
Yeah.
technique that I'm supposed to do here? And I find that that's a great opportunity to introduce techniques that are more enactment based or techniques that tend to steer the client more towards their experiences of affect. And in that respect, then they get to see how powerful those are when you can get the client to access them. So I find, like I said, it's a little paradoxical because one of the last things that I want to do is I want to give students this checklist and toolkit of just do X, Y, and Z, and you get this output. But when it comes to say any kind of hesitation towards looking at affect, these techniques sometimes can be very, very helpful, and it builds a little bit of safety, I think, for the students, for the beginning clinician to take some risks.
That's great advice. Thank you. So, I mean, you've mentioned this already, but are there any sort of readings or websites or other resources you would recommend for either educators, supervisors, or students who want to learn more about this?
Yeah, so as I said, I know APA has some really great products, some video products. They have actually a video of emotional prompts, if you will, that's really very useful. At least I found it has been useful. Again, I think the Alexander Street Press suite of videos is also helpful. Paul Ekman actually has some online trainings on displays of emotion on the face that folks can access for a reasonable price. Not that I'm advertising one thing over another, but it's a very well researched approach, and I think it's a good way of introducing students to being able to decode those facial expressions relatively quickly.
Uh-huh. And are those just found on his website, or you can kind of Google Ekman?
Yeah, I think pauleckman.com, honestly, is where you can find that.
Yeah.
It's called MET and SET, I think, for micro expression teaching tool, and then subtle expression teaching tool.
That sounds very helpful.
Yeah. And actually, Paul Ekman also did a project with the Dalai Lama and created what's called the Atlas of Emotions. And that's actually free. It's called atlasofemotions.org, I believe. And if you go on there, that's also a great teaching tool. I've used that with students because it takes I think it just looks at 5 of the universal emotions, and you're able to categorize them, look at depth and intensity. And it's very graphic based. So you sort of see how emotions go from very mild versions to very extreme versions as well. There's not a lot of video on there, but again, it's very kind of graphic, kind of hands-on, and folks, I think, have fun really exploring with that. So that would be another one I would recommend, Atlas of Emotions.
Yeah, that sounds very helpful. And sort of last teaching applied question, do you use any kind of credibility checks or measures that you encourage students to use either with their clients to kind of monitor how affect is being expressed or facilitated, or even that you might use in your own teaching in the classroom?
Yeah, that's challenging for a couple of reasons. Number one, there's not a lot of very well validated instruments out there for that purpose. Also, as our findings showed, that getting measures after the fact of expressions of emotion tend to not be as powerful as those external evaluations or the observer rating. And I think there's kind of a reason for that. If you're familiar with, or if you remember the Zeigarnik effect with memory, that once a task is accomplished, the memory for detail goes away. And I think there's almost an emotional Zeigarnik effect that happens in session, so that a video or audio recording of a session, when you go back and you re-listen to it, you go, oh wow, there was something important there. The client, once it's over and done with, might not fully recall the events that happened or the experiences that happened in there, but that they have an effect on behavior after the fact. They just don't really recall it. So that's kind of an issue. But to your point, we do look at things like outcome rating scales. So like Scott Miller's ORS and SRS, Miller and Duncan and Hubble's work. We look at those for the outcome piece of it. And then we also teach on occasion some of the emotion coding schemes that are used. The simplest ones are like the Klein expression of affect scales. But that requires you video recording and then reviewing those, which if there's one thing that I could leave folks with, clinicians and educators with, is getting as much video as possible of students working with clients, I think is critical. And I don't know about your experience or other people's experience. I know it's just so tough when students go to off-site practicum and internship sites that, for a variety of reasons, privacy and like, they just don't want to record anymore the way that they used to in generations previously. So I find that when we can do that, it's very, very helpful, but that's become more and more difficult.
Yeah, no, that's my experience as well. So what do you think are some of the most important lessons for us to take away from this research?
Sure. I think the first one is that emotion matters.
Yeah.
That, I think we've gone through over the last 10 or 15 years of a resurgence in trying to understand and value emotional expression in therapy, and not seeing it as something that potentially interferes with doing good work. And prior to that, we had a period of about 25 years where cognitions and behaviors, and actually behavior go back 40, 50 years, was privileged over emotion. And I think now emotions come back into its own. So I think that's very important. I think it's important for clinicians to know that it's okay to show emotion, and that it's also okay to be able to use expressions of emotion in the moment to deepen the conversation and deepen the relationship. Another finding that we found is that some clinicians actually prepare clients for the experience of expressed emotion, and that in the preparing them for that, here's what you might feel and experience, and this is what it might look like, actually maybe activates some change mechanisms and gets them ready to be able to put their experience in a larger context, and then be able to appreciate it from a different frame.
Yeah. And I think one lesson I take away, which might seem basic and obvious, is that it's not enough to just talk about the feeling. We have to help the patient, help the client feel the feeling. And that, I think, is also an important training element.
I couldn't agree more. You're absolutely right.
Yeah. So what do you think are the next steps in terms of the research we need to do, the changes in training we need to make?
Well, I'm I'm actually involved in some work in this area, but I think that there are developments coming up in the area of affective computing that can really help to facilitate clinicians getting feedback on emotions that are being displayed and the impact on the relationship. So there are research projects dealing with mathematically modeling the therapeutic relationship, finding areas of attraction or repulsion within the therapeutic relationship. Again, getting real-time feedback in terms of looking at the verbal and non-verbal channels to be able to offer some feedback to clinicians or trainees about not only how they're coming across, but maybe how it's being received. So I think the next 5 years, there's going to be a lot of exciting advances that can help clinicians become more effective in dealing with clients. I'm really excited to see some of this applied to some of the more difficult areas to treat. I'm thinking in particular substance abuse, as well as post-traumatic stress disorder. We know that the dropout rates for both of those types of disorders are far too high. And so to the degree that we can use these sorts of findings to help clinicians be more effective with these critical areas, I think can spell incredible advances for our field.
That's great. Well, it's certainly a very exciting area and so important for our teaching and training. So I really appreciate you talking about this with us today. And I think it'll be really helpful for teachers, educators, and students. So thank you.
Well, thank you. Thank you very much for having me.
Absolutely.